counteract some of the biomechanical dysfunction that you might have in your body, this comes from muscular imbalance or muscular dysfunction, mostly muscular imbalance. So, for example, if I have really tight calves, let's say I wear high heels all the time, or I jump or I run. When I go to squat, I need to what's called dorsiflex. This bone needs to get closer to this bone. See that? From the side, see that? This bone is getting closer to this bone. Well, what the calf does is it does the opposite. It brings those bones further away from each other. So if my calf is chronically tight and prevents this from happening, then that tightness in the calf will cause my foot to probably overpronate when I squat or land or run or lunge. So one of the things you want to do is foam roll your calves, right? So you take a foam roller, you're basically massaging it, and you foam roll your calves. Now, on the outside of your calves, you have the muscle called the gastrocnemius, and there's a medial and a lateral. So you want to foam roll both sides. Now, you can also dorsiflex to get a little stretch on the calf, because that's what you're doing, is you're trying to loosen up the fascia that surrounds the calf that might also be tight, and loosen these calves up. Okay? All right. Now, one of the other muscular imbalances they seem to find or find in common with people with Patella Femoral syndrome is a deficit between the quadriceps and the hamstrings. The quadriceps are too strong compared to the hamstrings. So that means it's possible that your quadriceps could be tight. So the same thing, you roll your quadriceps. And remember, you have quads on the lateral side. In the middle, don't roll your knee. Don't roll it over the top of your knee. And then on the inside, right, kind of a vastus medialis. So you roll all three sides. The inside of the leg, right over the top, and the outside. Now also, most people that jump, and I find I'm a cyclist, so when I'm riding big gears, my IT band gets really tight. And part of the joint capsule, I think, or the retinaculum of the knee, I might be using the wrong words, but the IT band attaches down in the tibia, so it crosses the knee. So if this IT band is tight, it could possibly contribute to pulling this patella towards the outside. So you want to also foam roll your IT band. All right. So you foam roll your IT band, your calves, and your quads. All right. Then you do this. Then you're gonna. Oh, your hip flexors too. Sorry, forgot about that. So your hip flexors are up here. So you foam roll those as best as you can. Kind of up in the front here, a little bit to the outside. Your tensor fasciolatus out there. Okay. And then you want to stretch all of those. So you can take a box, or look, I'll just take this foam roller and stretch your calf. You could do it straight-legged for the gastroc or bent knee. But be careful. A lot of times people screw this up. They'll do this. Look from behind. They'll go to stretch their calf, but instead of stretch their calf, they just bend the ankle in. Make sure you keep the ankle in neutral when you stretch your calf. See the difference of that and this? Okay? Then when you go to stretch your quads, there's a multitude of stretches. You can stretch them this way. You can stretch them, this way. I can't do it because I have 5 knee surgeries on my left knee, but I can stretch my right quad this way. You can do it where you go up to the wall. I kind of like this one. You just put your leg against the wall. and then slowly lean back towards it. You'll feel a big stretch here. Okay. Hip flexor stretch that I like is the hip flexor is an external rotator. So you internally rotate your knee like this. You're facing forward. Right? Then you kind of lean forward, so you're stretching this out. Then you take your hand up, lean back a little bit, and to the side. And you'll feel a big stretch here. You can also use a ball. Like this. You can lean on the ball, stretching your hip like that. Like this. That's a good stretch. Okay? So those are the three, your hip flexors, your quads, and your calves. Stretch those. Remember, one of the muscle weaknesses could be from having flat feet. So here's an exercise to help strengthen the muscles of your arch. They're called windshield wipers. You take a towel and you just put it down and put like a 3 or 5 pound weight. Don't put a heavy weight. And basically you're just kind of doing this. See? You're supinating your foot. So you're strengthening the muscles of your arch. Okay? And you just do reps of that. It's called windshield wipers. Although this exercise is not directly for the muscles of the knee, it's for the anterior tibialis, which is an antagonist to your calves. So if the calves are tight, then it might be good to train the anterior tib so you rob some of the neural facilitation or what's making this tight. And this piece of equipment is called a DARD. If you don't have one of these, then you can just sit on the edge of a bench, grab a dumbbell, and just do these. Okay, you can see the muscles it works. Okay, and that might help inhibit the calves that might be tight, that might be causing the flat-footed or the pronation, which might contribute to the Patella Femoral syndrome.